The member for Leeds Grenville has given notice of his dissatisfaction with the answer to a question given by the Minister of Health. The Minister from Leeds Grenville will have up to 5 minutes, and the Minister or the Parliamentary Assistant will have up to 5 minutes. The member for Leeds Grenville.
Well, thank you very much, Mr. Speaker. I'm happy to have the opportunity to once again discuss the important issue of the surgical services at the Brockville General Hospital. And I think, Speaker, it's important to look at what the CEO of the South East LHIN said in a newspaper article after I asked the question of the Minister of Health. According to the report, Paul Harris, the CEO, denied there is any plan to remove surgery from the Brockville General Hospital. He said, and I quote, "Not only is it not a plan, it's not even being considered by the LHIN or the team that's working on them," unquote. You know, that's great. And I think that based on those comments, should be pretty easy. I can sit down, the parliamentary assistant can stand up, tell me that this report's not going to be acted on, and we'll all be good. But you know, I hope that happens, but we'll wait and see. I hope what the parliamentary assistant won't do is give a response on how wonderful the government thinks the LHINs are operating, because you know, that's not the debate that we're having today. You know, I think what we want to hear is some words clarifying Mr. Harris, the CEO of the South East LHIN. He said this option to remove the surgical unit at BGH is, quote, "not even being considered." So what I'm looking for is a reassurance to my residents in the riding of Leeds Grenville that this is going to be removed from the discussion period. In fact, I'm really surprised that it still remains on the table after that same report quoted the LHIN CEO as saying vital hospitals include surgical and support services. Again, if the LHIN is truly committed in having, in its words, quote, 7 hospitals today, 7 hospitals tomorrow, and viable hospitals, unquote. When I hear that, I have to ask the question, why are we having this debate today? Well, we're having the debate because the minister didn't answer the question, defended the LHIN, and that's why we're here. So I'm very troubled. A week after I brought this up and hearing the reassuring words from the health minister and the South East LHIN that no one, and I mean no one, has stood up on that side of the House to tell me that this supposedly ridiculous scenario is out of the picture. That's what I'm hoping the parliamentary assistant will do. If not, I'm afraid it just feeds the fears and mistrust that I and so many others in Leeds Grenville have about the South East LHIN and their clinical services roadmap. And I think they have reason to be concerned. Last week, Mr. Harris was quoted by saying he was surprised that the consultant's report I quoted from, which said that the elimination of the Brockville General Hospital surgery was part of an ideal system design, wasn't posted online. Well, I need to tell you, to the members opposite, I checked today, Mr. Speaker, it's still not online. But you know what is online? A survey asking folks what the ideal scenario would be and what some of the thoughts that they would have on healthcare services. How can you get feedback from people without all the information being available to them? It gets worse. I checked. They're a quarter of the way through the consultation process. Yet again, they haven't had full disclosure. They haven't even had a public meeting in my riding. So you can imagine, Speaker, I've had lots of feedback. A lot of it has been very positive on the issues that I spoke up about last week. The overwhelming majority keep telling me to speak up, but I have to admit, I've had some people who said I was a bit over the top last week and was a bit too angry for my reaction. You know, it's true, I was angry. I was very angry. But you know, when I have doctors coming to me saying they're worried, then I get worried too. And that's exactly what happened prior to me coming here last week. And it's not the only person that has talked to me about this. I got an email from a lady almost minutes after a question period named Sue Salzer, a resident of Fort Erie. She began her email this way, quote, "I sit here with tears in my eyes. My sorrow is for you and the uphill battle you are entering to preserve your hospital services for Brockville," unquote. She and the residents of Fort Erie were very concerned, and they fought the fight. In fact, their member opposite has supported them. But still, even with that fight, they've lost their hospital emergency department, 2 operating rooms, and 40 medical beds. So I'm not yelling today. I'm asking, if I was so wrong and this scenario was so ridiculous, all you have to do is stand up and say it's off the table. Say that closing the surgical department at the Brockville General Hospital is not going to happen, and I'll be happy. Thanks, Mr. Speaker.
The Parliamentary Assistant to the Minister of Health and Long-Term Care and the member for Ottawa-Orleans.
Thank you, Speaker, and I'm pleased to respond to the member. The McGuinty government is dedicated to ensuring high-quality health care for all Ontarians. We have increased funding for Ontario hospitals every year since 2003, even in this tough economy. I think that says a lot about this government's commitment to health care. Hospital funding in Ontario has increased from $10.9 billion in 2003-04 to $16.3 billion in 10-11, nearly a 50% increase. In 2011-2012, the hospital sector will see an approximate 4.5% increase in overall funding. The elimination of the surgical department at Brockville General was proposed within the mentioned consultant's report as an option for clinical services realignment within the Southeast. This option was presented to provide contrast to additional options being considered for clinical services realignment. The Southeast LHIN is undergoing extensive stakeholder and community engagement to evaluate all proposed options for clinical service realignment. Community engagement is currently underway for an 8-week period to inform this project. Any members of the public or stakeholders within the Southeast can provide input to proposed options, such as any changes that would impact Brockville General, by visiting the Southeast LHIN's website. The Clinical Services Roadmap is a partnership between the Southeast Local Health Integration Network, the 7 hospitals across the Southeast Ontario, Brockville General Hospital, Hotel Dieu Hospital, Kingston General Hospital, Lennox and Addington County General Hospital, Napanee, Perth, Smiths Falls District Hospital, Providence Care, Quinte Health Care, Belleville, Bancroft, Picton and Trenton, and the Southeast Community Care Access Centre. The existing hospital system was built on a model that is decades old and that doesn't reflect the economic realities the area faces today. With hospital operating costs growing at twice the rate of inflation, the days of huge hospital funding increases are gone. Governments simply don't have enough money. The goal of this process is to create a regional hospital clinical service plan that spans the entire range of health care experiences, including emergency care, inpatient care, and rehabilitation. The result will be a high-quality, accessible, and financially responsible health care system in the region. Our investments at the Brockville General Hospital include more than $7.4 million increase in base funding from 2003 to 2004 to 2010-11, nearly a 19% increase. Wait time strategy. Since 2004, Brockville General Hospital received $5,789,788 to provide 4,368 additional procedures, reducing wait times in the community. As a result, wait times for the orthopedic surgery at BGH have decreased by 105 days, or 61%. Wait times for hip replacement surgery at BGH have decreased by 538 days, or 87%. BGH has the 5th shortest wait times in the province for this procedure. Wait times for knee replacement surgery at BGH have decreased by 300 days, or 82%. BGH has the 6th shortest wait time in the province for this procedure. Wait times for CT scans have decreased by 37 days, or 76%. BGH is currently tied with South Bruce Grey Health Centre for the shortest wait times in the province for this procedure, at 12 days. In January 2006, the hospital received a $4.5 million Planning and Design P&D grant to support planning for capital development on the Brockville General Hospital site to accommodate complex continuing care, rehabilitation and acute mental care beds and services being transferred from the Garden Street site, former St. Vincent de Paul site of Providence Centre, and from the Brockville Psychiatric Hospital, BPH, site to the Royal Ottawa Healthcare Group, ROHCG. The project obtained the government's approval to plan for a functional program stage in the 2009-10 Health Infrastructure Plan. The ministry continues to work with BGH to support its redevelopment project. The government is investing over $27 million in the Southeast LHIN through the Aging at Home strategy to support series at home. Yes, South East Lynn received $1,135,105 for initiatives that will improve ER performance and reduce the number of ALC patients in hospital. South East Lynn received funding for 3 ER physician assistants to perform a range of duties which will free up ER doctors, allowing them to see more patients. The South East Lynn received $250,000 for a nurse-led long-term care outreach team. The opposition do not get it. They want to cut $3 billion out of health care, but at the same time ask for increased service. Which is it? They don't have a plan. It's clear that Tim Hudak and the PCs have to go back to days of cutting health care, firing nurses, and closing hospitals.
Thank you. Thank you. The member for Ottawa Orleans. Thank you. Thank you.